All right. So please let us know where are you joining from today? Anyone here from the Philippines? Can you please type your location? All right. Anyone here from the Philippines, my dear nurses? All right. So how's everyone doing today? Can you please type yes if my audio is working well and if you were able to see my screen? Hello, Sime from Saudi Arabia. Hello. So, Saudi, it's already minus 5 hours there because here in the Philippines, it's already 9:02, if I'm not mistaken. So, minus 5 hours, it's 4. It's a 4 p.m., right, Saim? All right. It's a 4 p.m. All right. Okay. So, how about the others? How about the others, my dear nurses? All right. So, anyone here from the Philippines, from the U.S., Middle East, from Australia? Okay. Can you please type your location so that we can, okay, acknowledge you guys? All right. So, before anything else, I would like, of course, to introduce myself. Okay. I'm Christina Marie Parolan Endaya. You can call me Tin. And yes, welcome to AMN Healthcare. So, of course, I am delighted to be here with you today. So, just to give you a brief background about myself, I dedicated my career to the field of nursing. Okay, so yes, so with a particular focus on nursing education and mentorship, my dear nurses. So, okay, as you can see here on my slide, and all. Okay, so I hold a Master of Arts in Nursing, majoring Nursing Administration from University of the Philippines, and a Bachelor of Science in Nursing from Bulacan State University. So I'm proud to have passed the NCLEX or an examination, stopping at 75 questions and holding nursing licenses in both the Philippines and in the United States. So specifically in Illinois and New Mexico. I am CGFNS certified as well, and I've successfully passed. Okay, the Pearson test of English. So, with over 14 years of experience as an NCLEX or a lecturer and professor, I have had the privilege of training and mentoring many aspiring nurses. So, my expertise spans nursing education, sales, leadership, and management, as well as utilization review and management. So, of course, today I'm very excited to share my knowledge and insights with you, especially those of you preparing for your NCLEX or an examination. So, I know most of you, especially those nurses with, ATT or exam date, no? Okay, is approaching. Okay, so how's the level of anxiety? How's the level of anxiety, my dear nurses? How's the level of anxiety? Mom team, I'm so nervous. That's normal, no? Okay, but of course, when it comes to okay focusing on the concept, okay, doing some exercises, answering q banks, no, okay, it will lower down the level of your anxiety, right? So yeah. Okay, so actually, for today, I prepared a hot topic for your NCLEX or an examination, particularly what we call the mastering your critical cardiac care. So this one is essential insights in angina and myocardial infarction for NCLEX or in success. Are you excited, guys? So, Ma'am Teen, how's the probability of appearing on the NCLEX or an examination? So actually, based on the feedbacks of my student, and of course, yeah, based on my own experience, the probability of appearing on the NCLEX or an exam, yes, it's okay. It's a promise you will encounter this topic. It can be a pharmacological treatment. It can be health education. So, meaning something about this angina and your myocardial infarction, because these are vital concepts within the cardiovascular disorder section for your NCLEX or in test plan. So, given that the cardiovascular disease remains the leading cause of morbidity and mortality in the United States, so meaning understanding this condition is very crucial for nursing practice, right? So that is why your NCLEX RN frequently assesses candidates' ability or the ability of the nurses, no? Okay, so to differentiate okay, between the angina and myocardial infarction, their pathophysiology, okay, the management when it comes to certain management like pharmacological management, your nursing management, right, and patient education. So based on exam trends and practice reports, questions related to angina and myocardial infarction have an estimated probability of appearing between how many percent in okay, so actually it's between 10 to 15% with larger cardiovascular topics due to their high relevance in the clinical practice. So we all know that utilizing the ABC, right? Okay, so we all know that 8% of your examination will focus on prioritization. Yes, you will expect prioritization. And one of the framework of your prioritization, okay, is what we call your ABC, your airway, your breathing, and circulation. Yes or no? Yes, that's correct. Okay. So meaning you will expect questions, okay, about airway and breathing. So meaning what system is involved when it comes to your airway and breathing. So meaning that's your pulmonary and your respiratory system. Is that right? Yes or no? Yes, very good, my dear nurses. Okay. So what else? Another one is letter C. Letter C stands for anyone stands for your circulation. So meaning for your circulation, you will expect questions about what? You will expect questions okay, about your cardio, okay, very, your circulatory system, your cardiovascular, yes, okay, so sort of vascular, yes, okay, yes, okay, very good. Okay, so we have here Gladys. All right, from Philippines, watching from Negros. Hello, Sally. All right, very good. It's 4 p.m., right? Okay, very good. Okay, so meaning you will expect question, okay, about this topic. It's there's a high probability that it will appear on your upcoming NCLEX or an examination. So I believe that you're ready, guys. Can you please type yes? Type yes if you guys are ready. Type yes, type yes, yes. All right. So let's talk about okay, so let's first define. Okay, this is just a recap, my dear nurses, right? So, actually, my pen is not working, so we will be using, all right, the typing. Okay, so I will use my keyboard. Okay, so to input some important details here, no? So we have here your angina and your myocardial infarction. So actually, the main mother of your angina and your myocardial infarction is what we call your coronary artery disease. All right. So again, that's your coronary artery disease or your CAT. And this CAT has two types. We have your angina and your myocardial infarction. Okay. If NCLEX would ask you, what is the common cause of angina and myocardial infarction or your coronary artery disease? Simple as the presence of plaque. Yes or no? Yes. All right. So when we talk about there's a presence of plaque due to what? Accumulation of, yes, of fats, all right? So high levels of cholesterol, yes, so it will form a plaque and later on, okay, it will harden. Okay, so it will, yes, the plaque is what we call your atherosclerosis. And if it hardens, okay, so it will turn into your arteriosclerosis. Okay, so let's talk about specific to your angina and your myocardial infarction. So when we talk about of your angina, this is simply as anyone. Okay, so this is considered as okay anyone if you if you hear this specific medical condition, this is what they call your chest pain, right? Yes, very good. Your angina is a clinical syndrome characterized by chest pain. Okay, so just think of chest pain or anything that has something to do with discomfort in the chest. Okay, so thin. Okay, what is the common cause of this angina? Okay, so this is due to what? Okay, so this discomfort is due to the reduced blood flow to the myocardium. Okay, so we all know that we have, okay, the layers of our heart. We have your pericardium, your myocardium, and your endocardium. Okay, so we'll talk about a certain, for example, we are pertaining to a muscle. Okay, a muscle in our body. For example, our uterus. Okay, that's made of muscle. So just like the uterus, the heart. Okay, okay, very good. Consists of muscles. Very good. All right. So there's a layer. There, yes. Okay. So I mentioned that a while ago. Your pericardium, your myocardium, and your endocardium. Okay. So for your myocardium, that's the middle layer of your heart, and on the myocardium, okay, we can found the bundle of thick cardiac muscles. Yes or no? Yes, okay. So meaning they are responsible for the pumping, right? Okay, so very good. So for the angina, it is typically triggered by what? Okay, so what usually triggered angina? Okay, sometimes experience chest pain due to what? Ma'am Tin, due to NCLEX review. Yes or no? Yes. Shadow naman. All right. So example, usually the trigger of this angina or simple chest pain is due to what? Example, physical exertion, due to, yes, emotional stress, diba? Loss of a loved one, anger, what else? Okay, is anything that causes like, okay, a sudden outburst of your emotion. So it depends how you handle specific stress, right? Yes or no? Yes, very good. No, so later we're going to tackle about what is the drug of choice for this condition. Okay, so for the meantime, let's just define, okay, this angina and myocardial infarction. So angina again is a simple chest pain. Mumkin, can this angina lead, possible, okay, to lead, okay, or okay, might lead to myocardial infarction, yes or no? Yes, of course, no. Okay, so when we talk about of your myocardial infarction, this is also known as your, commonly known as your heart attack. Very good, no? In layman's term, this is what they call your heart attack. All right, so actually, another term for your myocardial infarction or your MI is what they call your ACS or what they call your acute, all right, coronary syndrome. All right, your acute coronary syndrome. Okay, so then, all right, so what is the common term that NCLEX might use? So actually, NCLEX, okay, uses both, okay, of this condition. So actually, I've encountered this now. Okay, on the first 20 question, I've encountered about myocardial infarction, asking for specific health check, right? And on the latter part, I've encountered ECS. All right. So yes, it's just the same. Okay, ECS and MI, it's just the same. Heart attack, my dear nurses. All right. Okay. So what happens here in the myocardial infarction or MI? So the MI results from what? There is what they call a complete occlusion of a coronary artery. All right. Again, there is what they call a complete occlusion or there is what they call the blockage. Yes or no? Okay, my dear nurses, what will happen if there is what they called, okay, a complete blockage in a specific artery? Okay, so any idea, my dear nurses? Okay, so how's the perfusion? Okay, okay, so very good, no? So that tissue or the myocardial wall will suffer? Yes or no? Yes. Right? So the myocardium or the myocardial wall will suffer and eventually leading to what? Ischemia. Ischemia. Because of that complete occlusion. Diba? Because the blood cannot flow. Alright? So meaning what is the problem? The perfusion, my dear nurses. Okay? So okay, that event of what they call ischemia, okay, will lead to what they call an irreversible myocardial death, or yes, very good, tissue or cell death, my dear nurses. Ma'am Tin, it's irreversible. Yes. Okay, again, it's irreversible. Okay, irreversible. Okay, heart or myocardial, okay, damage. All right, myocardial damage. Okay, so you may take a screenshot, take a screenshot. So meaning, Ma'am Tin, this one is more severe. Yes or no? Yes. And of course, it requires immediate medical intervention. Is this life-threatening? Of course. Okay, so Ma'am Tin, between the two, the angina and myocardial infarction, what is the most trending or, okay, the highest probability that NCLEX, okay, might ask? So actually, okay, uh, the severe form, of course, the myocardial infarction. And NCLEX will test your, of course, a skill, all right, your skills, your clinical judgment to specific emergency situation, okay, about, okay, how are you going to prioritize this specific condition, right? Okay, very good. Okay, so MI is, yes, more common in China. Okay, so let's proceed to the types. Okay, Mom Teen, there are types, of course. Okay, so but don't worry, and collect, okay, will not ask for the specific type. Okay, so actually this one is a good to know. Okay, so for the types under your angina, okay, anyone, do you have any idea, my dear nurses? Okay, anyone? Okay, so we have here Keisha watching from Nigeria. Hello. Angina can be relieved by rest. Very good. Abrileta. Okay, we have here Kay. Hello, Kay. Ayan, sige. So for the types of your angina, we have your anyone. We have your stable angina. What else? Anyone? This is just a recap, ha? Okay, we have your stable angina. We have your unstable angina. Okay, another one. Okay, the most okay, delicado, life-threatening. Okay, that's what we call your variant. Another term for your variant. Okay, your variant is also known as your Prince metal. Very good. Your Prince metal, my dear nurses. So how are you going to differentiate these types of your angina? So when we talk about if you're stable, so from the word self-stable, so this one thin, this one is predictable. Okay, this is a predictable chest pain. All right. So of course, this one is expected. Okay, expected to happen. For example, in the event or this predictable chest pain occurs with what exertion, and of course, resolves with rest. Yes or no? Yes, very good. No. Okay. So when we talk about the fear unstable, meaning it's unexpected because it's unstable. All right. So meaning this one is unexpected chest pain. Right. So there is what we call a worsening pattern of stable angina, indicating an increased risk for myocardial infarction. So between the two, this one is okay. Of course, more prone, or if there is an increased risk for heart attack, this unstable, okay, angina, right? Because this one is unexpected and there is a worsening pattern. Okay, so when we talk about of your Prince metal or your variant, so this one occurs what? Occurs at rest. Okay, so this one again occurs at rest. Okay, due to what? Okay, due to your coronary artery spasm rather than your atherosclerosis. So meaning, okay, usually the cause of this is not okay. Usually, of course, it can be your atherosclerosis, but here, okay, the most common one is your spasm. Okay, again, your coronary spasm. So actually, based on the World Health Organization, yes. All right. So this one might lead to myocardial infarction as well, and this one is, yes, this is life threatening. This is a silent killer. Yes, because yes, you're resting, right? It occurs. Okay, at rest. Okay, so due to coronary spasm. Okay, so let's proceed to the types of your myocardial infarction. So for your MI, we have here, okay, two types. We have your anyone, my dear nurses. Anyone, we have your STEMI, all right, and your, okay, very good, your NSTEMI. Okay, so when we talk about of your STEMI, this is what we call your ST elevation myocardial infarction. Okay, there is, yes, very good. There is, okay, an ST elevation. All right. Okay, so I believe this is just a recap, ha? Okay, again, when we talk about there is an ST elevation, so meaning then there is what we call a complete blockage of what? There is what we call a complete blockage of the coronary artery. Okay? So resulting in the full thickness damage. Yes, there is what we call the full thickness damage into the heart muscle or myocardial wall or the myocardium. All right. So there is a visible as ST elevation on the ECG or ECG strip, right? So that's your STEMI. There's a complete blockage. How about tin your and STEMI? Sorry, this one is your non. Okay, your non-ST elevation myocardial infarction. Okay, so here there is what they call a partial blockage. Okay, so here just a partial blockage, my dear nurses. Okay, so causing what subendocardial infarction only. So which presents without ST elevation, but may have elevated cardiac biomarkers. Okay, so we're going to tackle that later. So for now, you may take a screenshot. Screenshot. Well, okay, very good. All right, so all right. So, how's everyone doing today? Any okay? Can you please type your location for those who just recently joined? All right. So we can acknowledge your okay, we can acknowledge it. We have here Jahed from Jordan. All right. So hello po. Hello, hello. Ayan. So just type your location and now. Okay. So next let's talk about of okay. Let's talk about a simple pathophysiology. So actually, the medical surgical nursing is for most of the students, right? Okay, they're having a hard time, understanding specific disorder. Okay, so Tin, how are you going to manage to study a specific concept? No, okay. So this is just a tip. When you're studying a particular disease or a concept, very very important to summarize, right? So actually, okay, if you read this book, for example, if you love to read books, no, Brunner and Sudort, Saunders, no, and you're reading pathophysiology, and if you are not into reading, no, very comprehensive, very complex, no. Okay, one tip is very important to break it down. Okay, so simplify everything. Okay, get the main idea what is happening here in myocardial infarction. Okay, what happens here in angina. So very important, you know what happens to certain condition. Because if you know the problem, okay, the clinical manifestation will follow. And if you know the clinical manifestations, okay, you can now focus the specific intervention. Okay, so you can now choose the correct drugs, right? Specific health teaching. Okay, because NCLEX is very tricky, very important to know all of the principles. Okay, especially this hot topics or trending topics. Okay, because 80% of your examination would focus on health teaching, my dear nurses. And sometimes NCLEX will not mention the diagnosis, right? So I believe you're already familiar with that. Sometimes in the actual question, okay, there's no diagnosis, but rather, okay, there is what we call, an assessment, okay, subjective complaints, the problem, what else? The pathognomonic sign, as registered nurse, we must have solid understanding when it comes to what? Okay, the assessment. All right, so actually, okay, that's the next generation NCLEX is all about. That is why if there is a next generation NCLEX, okay, there's a case study for you to, practice more on your clinical judgment. Okay. All right. Okay. So when we talk about of your angina, let's have a brief pathophysiology now. This is just a brief now. So meaning what is the main cause and what happens here now? So when we talk about of your angina thing, you mentioned a while ago, this is just a simple chest pain due to what? Overexertion, emotional stress, reviewing for NCLEX, right? So meaning thin, no? All right. So there is what they call what? There is caused by. Okay, what is the cause? Caused by, okay, there is what we call an imbalance, okay? Between what? Between, okay, the myocardial, between, Okay, sorry for my spelling. I'm not into typing. I don't know. Okay, my graphic pen is not working right now. Okay, myocardial. Okay, so this is caused by an imbalance between myocardial oxygen supply, okay, supply and demand. All right. So actually, okay, so just to give you a brief pathophysiology, okay, your angina is caused by an imbalance between myocardial supply, okay, myocardial oxygen supply, oxygen, okay, so meaning tin, okay, there's a problem here in the oxygen supply in the myocardial wall. Yes or no? Yes. All right. So if this is the main problem, Ma'am Tino, so meaning when we talk about a prioritization, okay, between pharmacologic treatment and between oxygenation, okay, Tin, what should I prioritize? Which should I prioritize? Okay, so that's a big question. Okay, so let's park that question because that question, okay, laging nauulit yan. Alright. Yes, okay. So, we have a question ha. Okay, so, uh, which is your priority? Is it oxygen or pharmacologic treatment? Okay, let's park that question. Okay, so what else? So this one is commonly associated with what? Atherosclerotic plaques due to what? Okay, increase in cholesterol levels. You love eating a saturated di ba fat, some gips fat. Okay, very good. Okay, so that plaque, my dear nurses, or what they call your atherosclerotic plaques, it limits what? The blood flow. Yes or no? Yes. All right. So it can be relieved by stress. Okay. On the other hand, when we talk about of your heart attack or your myocardial infarction, it involves what? Okay, anyone. If this one, there is what they call imbalance between the myocardial oxygen supply and demand. So meaning the body, okay, doesn't, fully satisfy, no, the oxygen level or the demand, okay, na kailangan po ng heart natin. Okay, that your heart needs, my dear nurses, no? On the other hand, when we talk about the myocardial infarction, it involves what? It involves a rupture. Okay, so then there is what they call damage. Yes, it involves rupture. So when we talk about of rupture, okay, there's a damage here, okay, particularly in the myocardial wall or the myocardium. All right. Okay, very good. Okay, so just think of here, there is an irreversible, okay, damage. As simple as that. Okay, so here, sira na po, na damage na, my dear nurses, yes or no? Yes, alright. So here, if, aside from, there is an injury, there is what we call damage and it's irreversible, okay, there's a subsequent formation of thrombus that obstructs blood flow completely. All right. So the result is what? Okay. So what is the result of this one? There is, okay, if there's a prolonged angina leading to myocardial infarction, the result will be, okay, there is ischemia. Okay. And after ischemia, of course, if there's no, oxygen supply to specific myocardial cell or myocardial tissue, my dear nurses, mamamatay po ba? Yes, that's what we call cell death or what they call, there is what they call necrosis of your myocardial, okay, sorry, myocardial, all right, tissue. Okay, so did you get the difference, my dear nurses? So here, overexertion, stress. So here the problem is that there is just an imbalance, okay, all right, between the myocardial oxygen supply and demand. So here there is what we call damage, okay? That results from ischemia leading to necrosis of the myocardial tissue, okay? All right, very good. Nurses, can you please type yes? Type yes. Okay, so we have here Oz from UAE. Hello, ayan. So, hi, hi, hi. Okay. So, for those who just recently joined, could you please type your location so that we can acknowledge your presence po? All right. So, let's proceed to the clinical manifestations. Actually, for the clinical manifestations, I would like to highlight this one because, okay, this is the favorite part of your NCLEX. It can be in the form of select all that apply, or sometimes NCLEX, okay, will not use the diagnosis, but rather, okay, NCLEX will use what? NCLEX will use describing using the assessment or the pathognomonic sign. All right. Okay. So let's proceed to the common clinical manifestations pertaining to your angina or your chest pain. Okay. So yes, we've already defined this one. Your angina is your chest pain. Of course, the patient, okay, might complain of chest pain. Okay, so aside from chest pain, okay, the client or the patient might complain what there is what they call tightness. All right, tightness. What else? So there is what they call pressure, or what they call sometimes, okay, they will describe this as there is a squeezing. All right, squeezing. Okay, so that's the description of the chest pain of most of the patients. So sometimes the pain radiates to the shoulders, arm, and jaw, but it's more severe na, no? Okay, so what else? So aside from the chest pain, the patient or the client might also report what? There's what we call dyspnea. Okay, sometimes diaphoresis, my dear nurses. Okay, so take a screenshot. Take a screenshot. Okay, so let's proceed to your myocardial infarction. So actually, this one is an intense form of your chest pain. All right. Okay, so for the duration, we're going to tackle that later. Okay, so this one is more intense than your angina. Okay, and it is prolonged. It is prolonged, actually more than 30 minutes. Okay, because for the angina, the pain is relieved less than 20 minutes. For your myocardial infarction, this one is prolonged. Okay, more than 30 minutes. All right. So there is discomfort sometimes. The patient, okay, might complain of there's an elephant sitting on his or her, okay, chest. All right. So sometimes, okay, the pain does not improve with rest or nitroglycerin. So meaning that's an impending heart attack. Plus, all right, so we have here what they call your Levine sign. All right. So when we talk about of your Levine sign, this is what? This is a universal sign. Okay, this is a universal sign for your ischemic chest pain. Okay, your ischemic chest pain. All right. So then, okay, how does it look like? It looks like, no. All right. So papaano yan din, no? So for example, I'm experiencing heart attack right now. Wag naman, knock on wood, no. Okay. So the explanation of your Levine sign, okay, it is defined as an individual holding a clenched fist. Okay, so look at the camera, no. So this is my fist. Okay, I'm clenching my fist over the chest. So alam mo yon, parang sobrang sakit. So meaning, okay, the patient or the client has a low sensitivity but relatively specific for what? Ischemia. So meaning that's your Levin sign, no, an individual holding, okay, a clenched fist over his or her chest, plus what? Okay, the patient might complain what? Kasi minsan sometimes, no, hindi na makapagsalita yan. Okay, of course, there is what we call chest pain. And this chest pain, okay, was described as what? It is crushing. What else? It's crushing. And take note of this one. This one is radiating. Okay? Radiating, my dear nurses. Okay? So it radiates to left arm or jaw. Okay? So left arm or jaw, my dear nurses. Okay, and sometimes in between, okay, in between shoulder blades. Yes or no? Yes. All right. So what else? Actually, this one is the condition of my uncle. Okay, most likely it's genetics, right? Okay, very good. So it's on my maternal side, no? Okay, actually my tito before is I think he is 30 34 years old that time. Okay. Uh okay, when he had his first heart attack, sobrang bata. Okay, but it's the lifestyle, right? Genetics. Okay, of course the diet. So according to my tito, he cannot speak talaga. All right, so I asked him after his survivors. According to him, uh, sobrang sakit talaga, so sobrang bigat, like there's an elephant sitting on his chest. Plus there is what they call this, an aura. And what is that aura? Okay, so there is what they call an epigastric discomfort or feeling of indigestion. Okay, there is what they call epigastric discomfort or feeling of indigestion. So that's okay. Indigestion. So that's the aura for your heart attack, right? So what else? The patient might also complain fatigue, shortness of breath, sometimes vomiting. All right. So you may take a screenshot, take a screenshot. Okay. So this description, my dear nurses, please save this, ha. Okay, very good. Hot topic on your upcoming NCLEX or an examination. And this is the favorite description of NCLEX. Okay, lagi nilang ginagamit yan. Okay, very good. So actually, you can now define, okay, the angina and myocardial infarction. You can now differentiate, no, okay, angina and MI. So let's proceed to the diagnostics, my dear nurses. Okay, so one sec. All right. Okay. So what are the diagnostics for your angina? Anyone? For your angina, okay, so how are you going to determine if the patient is of course exhibiting angina? Okay, of course ECG, yes or no? Yes, okay. Can be okay, we can use ECG, of course. ECG, what else? Okay, so the ECG will reveal an ST depression or T wave inversion during an episode of chest pain. Okay, so there's what they call ST depression or what they call T wave inversion, okay, during an episode of this angina or chest pain, right? So what else? Stress test. Okay. What else? Coronary angiography for high risk patients. So imagine, no? You're just having an angina and you'll have this coronary angiography, no? All right. Okay. So how about for your myocardial infarction? For your MI, of course, still your ECG. Okay. So your ECG will reveal what? Your ECG will reveal okay your STEMI, right? So we talk about of your STEMI. This is what we call your okay ST elevation. There is what they call an ST elevation, my dear nurses. Okay, elevation. Okay, so for non-STEMI, of course, there is no okay S elevation, right? So may show non-specific changes for the ST. All right. So what else? We have here your cardiac, okay, your cardiac biomarkers. Markers. Okay, this one is a previous NCLEX question. For your MI, there is what they call elevated what? There is what they call elevated troponins. Troponins. I would like to highlight this one, your troponins, because your troponin, this one is the most sensitive okay cardiac marker, no, your troponin. Okay, 1 and 2. All right, so what else? Okay, so between the two, your troponin I or 1. Okay, so that's the most specific. Okay, so that's the most sensitive cardiac marker, no. So what else? It echocardiography to assess cardiac wall motion abnormalities. Okay, but most of the time, it's your ECG and your cardiac markers. Okay, so we have your CKMB. Yes, very good. Okay, so you may take a screenshot. Take a screenshot. Very good. All right. So next, let's talk about your Okay, your drug of choice. This one is a hot topic on your upcoming NCLEX or an examination. Okay, so for the drug of choice, Minnington, okay, we're going to study all of the principle under this drugs. Yes or no? Yes, okay. Again, we mentioned that angina, okay, the pain in angina is, okay, less than 20 minutes. Okay, less than 20 minutes, my dear nurses. And usually, okay, this can be relieved. Take note of this one. This can be relieved by rest or your nitroglycerin. All right. For the drug of choice, we've already mentioned we have your, okay, your nitroglycerin. All right, or your, sorry for the spelling, nitroglycerin glycerine or your NCG, right? Okay. So what else? Very important if you're studying a specific drug. Okay, so actually NCLEX would ask drugs about their, those drugs with toxicity. Okay, because you're going to monitor what are you going to watch out for. Okay, is that drug causing respiratory depression? What should be at the bad side? Okay, so you should know all of the principle under those drugs. Okay, so when we talk about of your nitroglycerine, okay, so what is the side effect of your nitroglycerine? Actually, when we talk about of your side effect, this are expected effect. Again, this are expected effect, right? So when we talk about of expected effect, okay, so meaning you're just going to document. You don't have to call for the HCP, ha. Okay, so you will educate the patient that, okay, your nitroglycerin will lower the blood pressure. Yes or no? Yes. And of course, okay, this one, most of the anti-hypertensive medication, okay, of course, it will lower the patient's blood pressure, and of course, most of the anti-hypertensive medication, okay, of course, side effect dizziness because of lowering of the blood pressure. Okay, so of course, okay, what are you going to watch out for? You're going to watch out for, okay, you're going to watch out for what? Watch out for orthostatic. Okay, orthostatic hypotension, especially in elderly, my dear nurses. No, so this one is in general for the antihypertensive medication. Okay, because NCLEX, okay, focuses on the safety of the patient. Okay, so that's our priority, the safety of our patient. Okay, so we need to watch out for orthostatic hypotension because your patient here, especially elderly, they are at risk for what? Uy, they are at risk for fall, my dear nurses. Yes or no? Yes. Okay, so very important. Okay, so for example, the patient is lying in his or her bed. Okay, and of course, teach the patient, okay, for what? Gradual change in position. Okay, gradual change in position. Because sometimes, of course, nakahiga yan. And, of course, pagkabiglang tayo, okay, sudden movement, okay, so, yes po, pwedeng mahilo yan, yung parang magdilim yung paningin, my dear nurses, no? And then suddenly, okay, especially for the elderly, no? Pag yan, okay, nagdilim ang paningin, okay, risk for fall. They are risk for fall. Okay, so very important. Most of the antihypertensive medication, okay, educate your patient gradual change in position. Okay, this is not just particular for nitroglycerin, but this one is okay in general for most of the antihypertensive medications. Okay, so what else? Let's talk about the route of this nitroglycerin. So your nitroglycerin can be taken, okay, sublingual. Okay, so what are the instructions? Okay, yes, sublingual. So meaning under the tongue. So take one tablet. Okay, take one tablet, my dear nurses, and wait for how many minutes? Wait for 5 minutes. Wait for 5 minutes, right? So if unrelieved, take note of this one. If unrelieved, what are you going to do? So actually, there are two answers, my dear nurses, no, because NCLEX. sometimes uses this now. So based on my experience and based on the experience of my students now. Okay, so first, okay, if you encountered a scenario like the patient is having chest pain or angina, and of course the patient took one tablet, and of course the pain is on relief. As registered nurse, okay, if the pain is on relief, what are you going to instruct your patient? Okay, so instruct the patient if on relief during the first tablet, instruct the patient to what? Instruct to, okay, go to the nearest emergency department or report it, if on the leave, report it to the HCP. HCP stands for the healthcare provider or the doctor, or go to, okay, the nearest ER or emergency department. Okay, so the other answer for this, sometimes NCLEX still uses this. Of course, this nitroglycerin can be taken 3 times. All right, with the interval of 5 minutes. So it depends on the options. All right, so it depends on the option. Of course, if this one is present, you will, okay, answer this one. All right. So if the other one is present, you will answer that. Okay. So between the two, okay, my dear nurses, this is our priority. All right. Based on the new update. All right. So again, the nitroglycerin can be taken, okay, 3 times with 5 minutes interval. Okay, with 5 minutes interval. Okay, so what else, my dear nurses? Of course, we also have here a nitroglycerin patch. Okay, so what is our instruction? Okay, so place the nitroglycerin patch. Okay, where? Of course, in okay, non-hairy part. In non-hairy part, ha. Non-hairy part. What else? Anterior chest wall. Okay, anterior chest wall for okay, for okay, how many hours? 12 to 16 hours, right? So rotate the site. Okay, so these are some of the principles for your, okay, nitroglycerin. Okay, so yes, yes, yes. Can you please type yes if you're still here, my dear nurses? Now, so we also have here Bristy from Bangladesh. Hi, Bristy. We have here Jakir, okay, from Bangladesh as well. We have here Tanisha, okay, Troponin. Tanisha, okay, Plavix, okay, aspirin. Okay, yes, yes, yes. Okay, so let's talk about the drug of choice for your myocardial infarction. Okay, so for your angina, again, this is just a recap. The pain is less than 20 minutes, and it can be relieved by rest or nitroglycerin. Okay, for your myocardial infarction, this one, the pain is, okay, prolonged or greater than 30 minutes. Okay, greater than 30 minutes. Okay, and unrelieved. Unrelieved by the nitroglycerin? Yes or no? Yes. And what is the drug of choice? If Alex would ask you, what is the drug of choice for your myocardial infarction? Anyone? Anyone? Uy, this one is a hot topic on your upcoming NCLEX or an examination, huh? You will expect this medication, okay? So anyone? Okay, very good. Okay, yes, your morphine sulfate, okay? If your patient is taking morphine sulfate, okay, what is the parameter that we're going to monitor? Anyone? What is the parameter that we're going to monitor? Okay, we're going to monitor for the RR. Why? Because we need to watch out for what? We need to watch out for respiratory depression. Okay, you need to watch out for respiratory depression. Okay, you already know the normal range for your RR, respiratory rate. So, for example, the RR of the patient is already, 8, no? Of course, you're going to withhold that, okay? Having toxicity, my dear nurses, okay? If uncles would ask you, what should be readily available at the bedside? What should be readily available at the bedside? If uncles would ask you that type of question, so meaning the patient is having toxicity already. Yes or no? Because asking for, okay, what should be readily available at the bedside? Okay, so meaning the NCLEX is asking for the antidote. What is the antidote? Your naloxone. Very good. Your naloxone or your Narcan. Ay, very good. This should be readily available at the bedside. Okay, so what else? What else? Another consideration. Okay, so we've already mentioned the laboratory, the cardiac biomarkers or the cardiac markers. The most sensitive, troponin. Okay, we also have your CKMB, your myoglobin. But if I would ask you, okay, the most sensitive is your troponin. Your troponin. All right, so that's for the drug of choice. Okay. So I have a question. Okay. So I have a question, my dear nurses, no? Okay. So if the patient is experiencing heart attack, okay, so what is your priority? Are you going, okay, to, okay, give oxygen or morphine to your patient? Uh, what is your priority? Oxygenation or morphine? Anyone? Uh, previous NCLEX question? Ah, what is your priority? Oxygenation or morphine? Okay. Let's hear from Rose. Okay, Rose. Okay, what's your answer? Rose, Atika, anyone? Either nurses? Mm-hmm. Okay, of course, our priority, okay, still oxygenation, my dear nurses, because let's go back to the basic. What happens, okay, during angina, okay, of course, that might lead to myocardial infarction. There is what we called, okay, this one. Okay, so there is, okay, okay, let's proceed the pathophysiology. There is what we call a tissue necrosis, right? So there's a death of the myocardial wall because of the ischemia. All right, because of ischemia, my dear nurses. So meaning when we talk about the ischemia, there is lack of oxygen to the myocardium. Okay, if that's the case or if that's the cause, of course, okay, we will provide oxygenation to prevent further damage. All right. So after oxygenation, we can now give morphine. Again, if NCLEX would ask you, okay, which of the following is your priority? Are you going to give oxygen or morphine? Okay, answer oxygen to prevent further damage. Okay, so very good. Okay, let's proceed to some of the common nursing management for angina and myocardial infarction. So actually, for angina and myocardial infarction, it's almost the same. So for your MI, for your angina, this one, just think of anything, okay, just think of anything, my dear nurses, that anything that mhm, that decreases, anything that decreases, okay, the workload of the heart. Okay, so if the cause is overexertion, okay, so advise or teach the patient, okay, rest in between, okay, very good. Okay, examples, rest, okay, rest, what else? Okay. Rest. What else? Avoid overeating. Yes. Instruct your patient. Okay. Do not overeat. Okay. Ma'am Tin, I'm so guilty. Do not overeat na. Samgyupsal pa nga. Okay. So what else? Okay. Ayan. No caffeine. Okay. For those, okay, with exam date, okay, approaching exam date, my dear nurses, now. 4 cups of coffee a day. Are you guilty? I'm so guilty here. I'm so guilty. Okay. Ayan. So what else? Avoid extreme temperatures. Okay, temperatures. Actually, these are the common risk factors for your, angina, myocardial infarction, hypertension. So meaning, if That's risk factor. Of course, you're going to modify that risk factor. So you're going to focus that on that specific risk factor. Okay, if the risk factor is okay, okay, excessive caffeine intake, of course, our nursing management or health teaching, okay, no caffeine. Avoid extreme temperatures. Okay, no smoking, no smoking. What else? No smoking. Okay, if one of the risk factor is obesity, okay, I'm so guilty here. Promote weight loss, yes or no? Yes. What else? Okay, reduce stress. Reduce stress. Mom Tin, I'm so stressed. I am so stressed. No, actually, we cannot avoid stress. No, we cannot avoid stress, but of course, it depends on the management. No, it depends on how are you going to manage stress. Okay, so focus on stress management, my dear nurses. Okay, we cannot avoid stress talaga. Okay, so let's talk about of your myocardial infarction, nursing management. So actually, it's just the same. Quit smoking. What else? Okay, we've already mentioned that. Okay, so same as angina. Okay, but here, okay, NCLEX, this one is previous NCLEX question. Yes, select all that apply. Okay, stop smoking. Okay, and let's focus on the diet. For the diet, so actually, if you didn't know the answer, just focus on being healthy living. Yes or no? Yes. Okay, so focus on low fat and also low salt. Uy, my dear nurses, ha, we did not or we didn't restrict sodium or salt intake. We just limit. Okay, so it depends on the order or prescription of doctor. So sometimes it's 1 gram, okay, or 1.5 gram, or 1,000 milligram, or 1,500 milligram. So it depends on the order or prescription of the doctor. But we didn't okay, restrict sodium intake. We need sodium. Yes or no? Yes. All right. So what else for the diet? Okay, low cholesterol. Low cholesterol. Okay, Mom Teen, I'm so guilty here. Low cholesterol. So meaning Mom Teen, I need to okay avoid some gipsal. Yes or no? Yes. Avoid that, huh? All right. So what else? Okay. So if one of the most common risk factor is obesity and sedentary lifestyle, okay, promote what? Uy, exercise. Exercise, no? Avoid, previous NCLEX question, avoid isometric exercises. Isometric exercises, what else? Okay, so what is the best choice for exercise, no? So walking. Walking, my dear nurses, is a good choice. All right. So yes, yes, yes. You may take a screenshot, take a screenshot. So I think we've already covered all of the important principle for your angina and your myocardial infarction. Okay. Yes, this uh yes, both of these are hot topic, trending topic for your NCLEX or an examination. All right. So yeah. Okay. So sobrang tama lang, sakto sa oras, no? So I would like to thank you. I would like to thank you guys, no, for being here and for your great attention throughout our sessions. I hope today's dive deep into angina versus your myocardial infarction is clarified this critical concept and their distinction. So as you prepare for your NCLEX, remember that understanding these conditions can make a real difference. No? So not just passing the exam, but in your future practice, where timely knowledge saves lives. All right. So again, this is Teen. Have a great day, my dear nurses. Bye bye. Thank you.